And let's now pass on to the last scientific speaker of the afternoon by Dr. Maria Luisa Denti from the Pediatric Hospital Bambini Gesù in Rome, and she will tell us about some aspects or potentialities related to the network for information exchange or synergies that might be originated for the study of these diseases, talking about the orphanet portal and what perspective that might generate. Well, my presentation will be less scientific compared to the past presentations. It will be more practical as regards the use of the orphanet portal, that is located at Bambini Gesù Pediatrics Hospital. A portal we always try to keep updated so as to give always reliable and updated information as regards rare diseases, to answer not only the scientists' needs but also the patients and the families' needs. Orphanet was born with the objective to serve the public and to provide accurate information in all the languages participating in the project. It was developed in a single database which is free and accessible to all the users without any form of registration, so no password is required. And it is also available at the website of orf.net. It was created in France thanks to INSERM and the General Direction for Health, and enters in Italy in 2001 thanks to some financing from the European Commission, thanks to the coordination by Professor Della Piccola, who started the data collection activity and data implementation activity. As of today, Orphanet is extended to 37 countries, and the European community has defined Orphanet as a project to be guaranteed within the prevention of rare and serious diseases through a joint action that started back in April 2011 with a 3 years activity plan, whose aim is to implement the website so as to improve the quality control of the information on the information entered. The Orphanet users at world level are over 20,000 with 200 visitors every day on average. Different types of users. We do not only have researchers and physicians or people in the pharmaceutical industry, but also students, families, and patients. The Orphanet Consortium is currently expanding to an extra-continental dimension. In 2011, Canada also joined, 2012, Australia joined, and now negotiations for collaboration are underway with some South American countries, Argentina, Chile, and Brazil, and also with China. The database, as I said, was born in 1997 and is only available in was only available in French till 2001, and then changed into different interfaces from a simple portal for a simple database to a real sophisticated portal. And this is the interface which is available for 1 year now, the new interface, which, as you can see, is available in the 6 languages: English and Spanish, German, Italian, and Portuguese. Now I will show you from a technical point of view how it is possible to use our website. For instance, when you want to search for information on a specific disease, you can search for it by entering the name of the disease you want to search, by clicking here, rare diseases, or through orphan drug, or the center you want to search for that pathology, or a diagnosis lab where you can have the test, through clinical trials, research and experimentations, through patients' associations, professionals and institutions. I now go quickly through some examples which I have brought as regards LGMDs. Research might be carried out through the name of the pathology by entering LGMD, as we heard today. You can have the different subclassifications, and if we want to get, for instance, into the detail of the 2E type, you just click on the pathology, and there you have the so-called identity card of the pathology, where you can find the number of orphanet, because each disease has a codified orphanet code, the prevalence, transmission, and the onset age. And then a text describing the main characteristics. The text is drawn in French by the experts selected in France, because France coordinates the network. And thereafter, in the different countries, we translated text. So sorry if sometimes the texts are not exactly updated, but we always expect for France to give us the new text to be translated and to be updated. However, we are working a lot on that because in this case the update dates back to 2004, so it would require updates. This is another example, a pathology with updated text with the Kabuki syndrome. Every text is now structured and standardized, thus divided into different sections, so independently upon the pathology you will all find the same descriptions. At the end of the text you can also enter, and this is a novelty of the last year, a comment, an interactivity report, where everybody, family member, patient or researcher, may enter a question or a comment on that specific pathology. At the end of the summary of the pathology, when available, there are specific direct links to scientific articles talking about the pathology guidelines, guidelines for diagnostic texts and general articles. Again, you can have the search, again under rare diseases search, you can search the pathology through the gene name. So, and again, an example. Here you have the same results you have already seen before, LGMD type 2E. And if you click on it, you get back to the same view you saw before. Again, you can search through the diagnosis laboratory. For instance, if you want to know where it is possible to have a test for that specific pathology in Italy or anywhere in the world, you can have the search by entering all the countries. You can have some very dispersive results, but you can limit the field by entering here, for instance, Italy. And there you have the centers that have been currently reported to Orphanet that make the immunohistochemical or molecular tests. Again, you can search for the pathology through a specialized center. To get to know the centers that deal with LGMDs in Italy, you can easily make this search. Well, on Orphanet, actually, each pathology is divided as following a genealogical tree. So when you look for a specific pathology, you can find all the specializations and the specialization consultancies of the upper group. So LGMDs are part of neuromuscular diseases, so sometimes you do not find a specialist that only deals with maybe clinical trials in LGMD type 2E, but of neuromuscular diseases in general. But you can put a filter in there looking for only LGMD centers or only those dealing with genetic consultancy, and you can select whether you want a pediatric center or an adult center. One more example, by selecting one of the centers, I just reported one of the Bambin Gesù Hospital. You have the view with the reference or with all the phone numbers and email addresses, so you can contact the center. Again, search through patients' associations. It may be followed through different modalities. You can search through the name of the disease, of course, by selecting in Italy LGMD. Well, here you have all the associations, and to my pleasure I can show you how GFP association is currently indicated in Orphanet, and by clicking on it you can find all the information required on the association and with a direct link onto the website. If you want to search, another thing, at the end of the view of the screenshot, you can find the reference of the disease group. By selecting here, you again have that the GFP association is connected to LGMD type 2E. Again, you can search associations by alphabetical order or by selecting the country you're interested in. For instance, if you want to have a list of all the associations in Orphanet, you can just follow them in alphabetical order. Right, to give you an idea of the procedure to enter data in Orphanet, there is a specific form which is actually filled in by the chairman of the association, making the request for data insertion, and it is exactly what Mrs. Vola did. Where do we get the details and the data that are entered for consultancies, patients associations, and so on? Well, we collect data wherever possible, particularly through the associations that are signaled by the local center, by associations, through personal contacts we have at meetings and conferences, through our partners, Teleton for instance, and Uniamo, but also contacts through email to the Orphanet website. As at today, these are the figures for Orphanet Italy, updated at March 2013, just to give you an idea of the number of data that have been entered from 2001 to today and that are regularly implemented. Instead, this is the web page of Orphanet Italy. While all the single countries have their own web page, which is the same for all of them, then each single country has their own web page, which is not the one translated from the official French. So we have the orf.net, which is rigorously managed by France, so as not to avoid excessive dispersions. Orphanet Italia, instead, the web page of Orphanet Italia instead is managed at local way with information on events, conferences, and any other news may be actually entered by our group. Here's an example. We always have connections with the Sanità News, which is a daily report on rare diseases, on Teleton, or also events like the first GFB National Congress, which we have reported on our webpage. Orphanet also avails the other products derived to widen, to resonate information. For instance, the Orphanet Journal of Rare Diseases, as you know, it is a journal, a highly impacting scientific journal that publicizes reviews on rare diseases, or the bi-weekly Orpha News newsletter. You just register on the website and you can read either the last newsletter, or if you register here and click on subscribe. Starting from December 2011, we also followed the Italian newsletter. So we, as Orphanet Italia Group, we translated a newsletter. So if you do not speak English very well, but you want to receive information as regards different aspects of rare diseases, you can actually receive that in Italian at your direct email address. In December 2011, we started with the Italian version with about 1,150 subscribed people. The newsletter actually relates, this is an example of the newsletter that you might receive at your email address with information regarding USAID and political news on the European Union, and more scientific news, for instance, the discovery of new syndromes, new genes that are more and more in number thanks to the new exome sequencing techniques, and the research is underway, new therapeutic approaches, different information for patients and on drugs for rare and orphan diseases, and new initiatives, events, and so on and so forth. Then, very last slide to show you that apart from the online material, we also are able to provide the paper documents. And, well, it is quite difficult to do that because there are novelties every day. From 2012, we have had several new data to be added, but we will try to produce a new version as soon as possible. And also the book of the Italian associations that was drawn in collaboration with Uniamo and with Farmindustria. And thanks to the Orphanet Italia team, I'm part of it, but I mostly work about the translation from English to Italian. Professor Dalla Piccola is, however, the chairman and main coordinator, with Professor Mingarelli and all the 8 ladies, particularly Dr. Roberta Ruotolo, who actually works specifically with the patients' associations, and she actually interacted with your association for the orphanate data collection. And thank you for your attention and your participation. Well, apart from the male discrimination in this case, well, we would have to ask for some male participations in this group, but really thank you for this wonderful participation, and I would like to give a reflection on that. I am a supporter of the network and of its potentialities, but of course a website like Orphanet and all the sites we want to create, we are creating one for another type of rare diseases, as I said before. We require maximum utmost collaboration by everybody, patients, clinicians, basic researchers, mostly to keep these websites alive and updated, because website updates is fundamental to find the right information. So we really have to commit on that. We are sometimes too lazy. Yesterday I updated my data sheet because I saw that there were some mistakes. We all have to be very much committed in both treating and in being impacted by these rare diseases, because these are very important tools that play a fundamental role. If you have any questions, of course, or any suggestions definitely, or comments only to this presentation, yes. You were very comprehensive. Thank you very much.